Okay. Humphrey, thank you for the gift of this of the cup. Say no to drug abuse forever. That's your YouTube channel, and also for the shirt, the T-shirt. Say no to drug abuse forever. That's your YouTube channel, and then stay away from drug abuse. That's the Instagram. So I'm happy to have known you, to have known Humphrey Ikhanoba for quite some years now. That should be close to 8 years now. Humphrey Ikhanoba has been someone doing very well initially. Quite a number of the students that he took in their preparatory classes for UTME, that's Nigerian's matriculation exam, to gain admission into the university. It's taken quite a number of people in town. Quite a number of them have graduated today. They are now pharmacists, and we were even close at a time, close to the level that there was a time we were attending the same church, and I used to follow up to find out if he was in church, because it's quite a large church, so we may not see. But along the line, I left that branch of our church to another branch. I was posted there as a pastor in the church, and so I used to follow up on Humphrey to find out how you doing while you're in church. But I saw at a time that he wasn't comfortable with me like before, unlike the way he used to be. In fact, he was actually avoiding me. So I suspected something was wrong, because being a neuro-psychopharmacologist myself, I know those are part of the trains and signs and the triggers. So I suspected something, but I couldn't lay hand on exactly what was happening until a time came that I just had some disturbing news concerning him. He went to one of our lecturers, a senior colleague of mine, a professor, and he was speaking on behalf of his colleague who was caught in exam malpractice, and he felt the lecturer, what is your problem? What can I do for you? Release my friend and whatever, I will take care of you. I'll pay you more than the system can pay you. And the professor was surprised. Of course, he's a drug formulation expert, a pharmacist, but not a neuropharmacologist like some of us. So when I heard that, it was now obvious that something had happened. For the Humphrey I used to know, to be able to face a professor and make such demands and was that bold, I knew something was wrong. But I couldn't still see him, because I was told after that encounter and episode with the professor, he had to leave. So it was a couple of days later, I now heard the situation had gone so serious. He organized a birthday, so to say, for his pet dog, and then spent hundreds of thousands of naira, close to between 500 and 700,000 naira, and birthday for us here with the economic situation of Nigeria. So anyone that will do that, really, for the dog, even for one person, just a birthday, not a milestone of a birthday, that itself is suspicious. So it was obvious that something was wrong until the thing exacerbated, and he was rushed to the hospital. He went to the university administrative building. He wanted to challenge the authorities up to the vice chancellor. The security men had to take him to the health center, and he was violent. So they had to use the ambulance to take him to the mental ward of the teaching hospital here, where he was stabilized. But even post-stabilization, he wasn't benefiting so much with the antipsychotics and all the other drugs that was being given. So the sedation was waning out even after he was given further doses. So he had to go out. The exam of that session, of course, he failed it because some of the papers he did not even do. And we were involved. Fortunately for him, that session, I was the faculty examination officer that processed the result. Subsequent session, I was involved too, so in processing the result. We have to find a way around because of the health situation. We obtained a medical clearance from his consultant, which we were able to tender at the faculty board of examiners that cleared him, and then we obtained a retroactive leave of absence for him. Now, also, as recent as late last year, we weren't sure of the situation with Humphrey, because the second session was already going. In fact, in one of the sessions when I was the head of department, the final year exam that he took, the course, being the chief examiner, the head of the department, I know the questions. He was to answer 5 questions out of 6. And after the exam started, different venue. So I went to the venue where Humphrey was. I wasn't there to see him. I just went there to see how the exam was going on. And I just noticed on the table one candidate had submitted around 35 to 40 minutes for a 3-hour paper. A candidate had submitted the scripts. So I was looking at the scripts. What is it? Is this that this is an unused script that this candidate made a mistake so that we can tear it and or keep it and properly labeled for an evidence in case anything happens? I was told no, that one candidate has finished. He has submitted the script. I looked at my time. This is just about 40 minutes into a 3-hour exam. They said it, asked the man, he said it's finished. I rushed out. I ran after Humphrey. And when I saw Humphrey was so confident. He told me, look, I've finished. There's nothing there. In fact, he told me, he said, your own question, it was the best, it was very easy. I said, did you answer me? He said, yes, I did your question. I mean, I didn't need to spend 5 minutes in your question. I was asking myself, is it the same question? The question the exam that I said, okay? I mean, I had to leave him that time because 5 questions, according to him, essay questions that he finished in 40 minutes. I had to leave him like that. At that point, I knew something, an urgent intervention was needed. Well, we thank God also for the father who didn't give up on him, because a number of occasions we have had to invite the father, the sister also, and they have attempted so many interventions for him. But the intervention came late last year, early this year, because up to late last year, was he having some serious issue when he had to relocate to Lagos because of the lockdown again. That also was about having a good effect, but because he went to Lagos, and in Lagos he had access to all these drugs again, and then some relapse. But thank God an intervention came when he got introduced to a center in Benin or in Edo State, where they use alternative medicine as an intervention, and that really worked for him. I'm glad today that this is the Humphrey I used to know. This is the Humphrey in his part 1 who was a former class rep. This is the Humphrey who was very active, even right from secondary school. This is the Humphrey who was organizing and giving preparatory classes for those who want to come into the university, and for even 100 level students who are doing basic science courses before they come into the faculty. This is the Humphrey, and it gladdens us. I am particularly elated and particularly fulfilled because quite a number of people have associated him with me in those days, and of course we didn't give up even when he had the challenges. And well, now we can see how a man's life can change within a short period, how a man's life can be transformed. And I'm glad when he came to me to share the vision of his move, this Say No to Drug Abuse move. It started not too long ago, and within a very short time, he has grown. The YouTube channel has grown, the Instagram too has grown, and is very, very much passionate and then persistent about this. And within this short period, he has been of help to many people as a survivor. He has been a help to quite a number of people under this yoke. Drug abuse, simply put, is a yoke. I mean, I've seen people close to me. I have family members, nephews. I have a nephew who Humphrey is trying to also help out now through this is a channel. There's just a testimony of one now that through his channel he's been able to reach out to. I mean, I will probably take just a minute to read the testimony of this young man. I won't mention his name. He said, "Good evening, sir. I used to abuse cannabis and nicotine. I never did Rohypnol, nor did I take crack through cocaine, and I didn't take also any intravenous substance. But my abuse of cannabis was so awful, it got to my parents, and they thought I was going to lose my life anytime soon. Meanwhile, I just left a 1-month rehab program, which taught me a lot about mental health and its importance in the society. I said, this is my 4th day out of rehab and nearly my 2nd month of abstinence as well. And I'm doing fine. Moreover, I have gone through your Instagram page and realized how drug abuse is ruining our youth, painting a bad image of them in the society. Hopefully, I can join the team to spread the word. Say no to drug abuse." So this is this young man's message to Humphrey after the short time they have interacted. Like this young man put it, drug abuse ruins lives, ruins destiny. You know, people with great potentials, they have had their life ruined. We thank God for Humphrey that he was able to realize just before the life could have been ruined. I'm glad to let us know now that Humphrey is back in class, attending lectures. His practicals are going on very well, and he chose a very good topic to study for his final year dissertation, his undergraduate project. I mean, he's studying on Raufia. Presently, he has finished the extraction of his of making his extract, which is going to use to study this, because this is one of the alternative intervention that he was given at the place where he went for the last rehab in Edo State. It worked for him, so he's trying to understand and then bring out the scientific basis of the plant itself. So I want to invite as many one of us who will listen to this to join this channel, both on Instagram and on YouTube. And then in case you know other people, friends, loved ones, family members, your children, or your guardian, or your mentees, people that you know that are under the yoke of drug, they can learn from Humphrey. If Humphrey was able to get out of his own, they can also get out of their own. Let them just sign in into this, join this group on either of the platform or all of the platforms, and then let them join us in spreading this. We are also trying to bring up, enlarge this group. We are already discussing with a consultant mental health physician in the university, quite a number of people, even his consultant. I discussed with his consultant last week. He's interested in trying to join. He's a very senior consultant in mental health. Many people are trying to join with him. This is real. Whatever you have seen, whatever you have heard from Humphrey is real. It's no fluke at all. We were there pre-drug abuse for concerning Humphrey. We also saw him during his period of ordeal. And we can also see and testify to the fact that this is Humphrey, is real, is a final year student of the Faculty of Pharmacy, Obafemi Awolowo University, Ile-Ife, Nigeria, Southwest Nigeria. So join us, be part of this, and let us join hands together to rescue as many people that are outside there under this yoke. Thank you very much. Okay, yes, my name, I am Dr. Oluwole Isaac Adeyemi. I am a neuro-psychopharmacologist. That's my specialization in research. An academic staff and a researcher in the Department of Pharmacology, being a head of department at a time of that department. And presently I'm the vice dean. In some places they call it the sub-dean of the faculty here in Ife. Thank you very much.
All right, thank you very much, sir.
Okay.